I think it can almost be insulting to somebody struggling with major depressive disorder, when someone who's never experienced major depressive disorder tells that person, just get outside and go take a walk. Like, just get some sunshine, get some fresh air. And they say it so nonchalantly, almost like it's easy to just fix their problems by going outside to take a walk. And I don't think that the person who says that has the intention to be offensive, but it lands on that person in an offensive way, because they have no idea how hard it might be for that person to do regular tasks, everyday tasks. When you're in the midst of a major depressive episode, you don't want to do simple tasks like take a shower. That can feel insurmountable. You have no energy, you're lethargic, there's no motivation. What's the point? For what? You just want to recluse, you want to go back to bed, pull the covers over your head. That's how depression acts, and it can be debilitating. 5% of the population at any given time is struggling with major depressive disorder. The people who have major depressive disorder are 20 times more likely to commit suicide as the general population. It's a very serious mental health disorder that, if left untreated or mistreated, can have negative consequences such as premature death or unjustifiable mental suffering, which is sad because it's unjustifiable mental suffering from something that's entirely treatable. And it would behoove us and benefit us to start to really open up the dialogue, to talk about the complexities related to the causes of depression, the symptoms of depression, so that we can better recognize it and know when to ask for help, or the treatment modalities available, or the efficacy and success rate of those treatment modalities, so that we can make an informed decision about how best to combat those symptoms. Symptoms that the DSM-5 characterizes as sadness, emptiness, hopelessness, worthlessness, anhedonia, which is a lack of enjoyment in activities we once found enjoyable. So the things we used to find enjoyable, we no longer find enjoyable now. Changes in appetite, so increase in appetite or decrease in appetite. Changes in weight, increase in weight or decrease in weight. Hypersomnia, insomnia, suicidal ideation, self-harm, or an inability to make decisions all day, nearly every day. And if you have some of those criteria met, it would be in your best interest to consult a professional to go through an assessment and talk about what are some of the options available to us when we start to experience those things. There's biological, psychological, social, and behavioral components to all mental health disorders, including major depressive disorder. Maybe you've already tried to tackle some of the biological components of major depressive disorder. Maybe you've gone to your doctor, you've done some blood work, you've checked your thyroid, because 20% of people with major depressive disorder struggle with low thyroid. Maybe you've checked your cortisol levels. Maybe you've practiced strategies and interventions in order to influence your cortisol levels, right? Because an increase in cortisol levels over an extended period of time can increase your susceptibility for major depressive disorder. So maybe you've gone through those avenues in order to combat your major depressive disorder and treat it. Or maybe you've gone to a psychiatrist. Psychiatrist has told you that you have an imbalance or deficiency in neurotransmitters or neuromodulators such as serotonin, norepinephrine, or dopamine. Those are neurotransmitters that influence your mood, that can influence your motivation, that can increase your ability to stay alert. Without some of those, you can feel lethargic, inability to focus, lack of motivation, unhappy, depressed. So then they prescribe you an antidepressant. And maybe you've already tried a tricyclic antidepressant to no avail. So then you switched over to a monoamine antidepressant, but you can't give up the aged cheese and the kimchi, and you're struggling with high blood pressure. So then they switch you over to an SSRI, a selective serotonin reuptake inhibitor, to try to influence the serotonin levels, and maybe that's worked for you. Maybe you're of the 2/3 of people that experience some relief from taking an antidepressant, which is a good thing. Or maybe you're of the 1/3 of people who don't experience any relief. Then what? Then what do you do if you've already tried an antidepressant? Or maybe you haven't tried an antidepressant yet, and you've started your research. And maybe you've stumbled upon some of the more recent research that shows that although people who take antidepressants experience some relief, they do not experience a statistically significant amount of relief as opposed to those who take a placebo. So those who take a placebo and those who take an antidepressant experience similarities in the relief of depressive symptoms. Or maybe you stumbled upon recent study that shows that physical exercise has a higher success rate for treating depression as opposed to talk therapy or antidepressants. Or maybe you've explored some of the adverse effects, the side effects of taking an antidepressant with your psychiatrist, and they've described to you that taking antidepressants can have side effects such as sexual problems, daytime tiredness, weight gain, memory concentration issues, osteoporosis, heart disease, strokes. And maybe you don't want some of those side effects. Maybe your psychiatrist has explained some of the physical dependency that people experience on antidepressants, that when they're not tapered off correctly, they may experience withdrawal symptoms, headaches, brain fog, depersonalization, derealization, flu-like symptoms, sleep disturbances, anxiety, tingling sensations, hypertension, and sweating. And maybe you don't want some of those withdrawal symptoms that 1 in 4 people describe as severe. So maybe antidepressants is not the right avenue for you to combat your major depressive disorder. So maybe you go to your doctor or nutritionist and they tell you that you should increase your essential fatty acids, omega-3s, that it's shown that omega-3 fatty acids have a similar efficacy rate in influencing serotonin. Or maybe they tell you to take more creatine because it can influence the phosphocreatine system in the forebrain, which can also influence your neurotransmitters. And maybe that's been effective. But what if you've tried to address all of those different avenues to combat the biological components of depression and it hasn't worked? Then what do you do? So maybe then you've talked to a therapist, try to recognize cognitive distortions, anti-self-confabulation, negative perspectives on your outlook on life. Maybe your therapist has come to you and said, listen, if you want to feel better, I need you to start engaging in these behaviors. If you engage in these behaviors, it'll help you feel better. But most clients say, I don't want to engage in those behaviors. I'll engage in those behaviors when I feel better. So then the therapist come back and said, no. I need you to engage in the behaviors in order to feel better. And then the client says, nah, I'll engage in those behaviors when I feel better. So then they wait to feel better before they engage in those behaviors. Their lack of engagement in behaviors makes them feel more depressed. The more depressed they feel, the less they want to engage in those behaviors. And it starts a downward cycle. And what I'm talking to you about is behavior activation. It's engaging in them behaviors even when you don't feel like it. And I want to emphasize how hard that may be when people suggest that you engage in behaviors and you're in the middle of a depressive episode and you don't even want to go take a shower. You just want to go back to bed. You don't want to talk to anybody. You don't want to socialize. You don't want to do anything. Do those things for what? Like, what's the purpose? What's the meaning? Because when you're in the middle of a depressive episode, that's how it talks to you, right? It tells you, like, what is the purpose? What's the meaning? You have no purpose. There is no meaning, which is a very, very dangerous thought. It's a very dangerous belief. It can be related to suicidal ideation, because if you don't see a purpose and you don't see any meaning, then what's the point of living? You know, back at the beginning, I was talking about one of the symptoms is guilt, even when there is no reason to feel guilty. But what if depression is more of an existential guilt? What if you're feeling guilty because you know that you're supposed to be of service? You know that you're supposed to contribute. You know that you're supposed to get into the solution and out of the pollution, that you're supposed to give back. What if there's something greater for your life? What if you're feeling guilty because you're not living within your purpose, because you haven't created one yet? What if that's the whole point of depression, is for you to be able to extract that lesson? It's telling you to stop and stay stagnant, to go inside. That question of what's the purpose is not supposed to lead you to death, but it's supposed to lead you to a newfound life. What if that's the purpose? What if you're not supposed to just go through depression, self-medicate your depression, but you're supposed to grow through depression? What if that's a time in your life where you're supposed to hit pause and ask yourself, like, what do I value? What problem needs fixing in this world? Who do I want to be? Partner studies in 2013 and 2017 showed that increase in purpose is associated with emotional regulation and resiliency in regards to mental health. Another study showed that participants with depressive symptoms associated those depressive symptoms with a lack of meaning and purpose. So if you've already tried to combat your depressive symptoms with biological approaches to no avail, and maybe behavior activation doesn't sound so enticing because you don't see the purpose, then I'm suggesting that maybe you start to develop and create and ask yourself, like, what do you want your purpose to be? And then engage in those behaviors that are consistent with your purpose. That purpose has got to get you out of bed even when you don't feel like it. It's got to get you dressed even when you don't feel like it. It's got to be something that you really believe in. And maybe that's exactly what depression is trying to teach you. Maybe it's not trying to kill you. Maybe it's trying to show you exactly who you were meant to be. And if you don't know what your purpose is and you can't figure out how to implement behavior activation, then I behoove you to ask for help before it's too late. Timber approves this message.